Hey everyone, welcome back to my channel for my 35-week pregnancy update video. So right off the bat, I just want to apologize. I intended on filming this video much earlier in the day, but it ended up being a crazy day. So if you notice that I look pretty tired or that the lighting is less than ideal, it's because it's 10:30 at night. So we're just gonna make the best of it. So I actually haven't posted a video since my 30-week pregnancy update video. It's been a roller coaster over the last few weeks, which I'll get into more as we go through this. But I've just been trying to prioritize my resting and prioritize my health in general. So it's been a while, but I really wanted to get this video out, so I hope you enjoy it. If you do enjoy this video while you're watching, I'd love it if you would give it a thumbs up, and don't forget to subscribe if you haven't already. I've also mentioned before, if you're not following me on Instagram, that's probably where we're going to post the first kind of update on when baby is born. So make sure you go follow me over there for more up-to-date updates on the baby. Okay, so first off, I'm just going to go through some of my symptoms over the last few weeks. Obviously, third trimester, everything is just uncomfortable and hurts more and stuff like that, but I'll try to give you some specific symptoms. So contractions have definitely been more intense, more frequent, more Braxton Hicks contractions, as well as some real ones actually, which again, I'll get into that in a little bit with more updates. Otherwise, everything's just feeling very low pressure. It's hard to fully empty my bladder at this point. Lots of lower abdominal pain, backache, lightning crotch. If you've never heard of that, consider yourself lucky. It's as bad as it sounds. Otherwise, it's just very uncomfortable sleeping, especially. I find I have to sleep in very specific ways now, or else I start to feel unwell or dizzy or whatever. Those are most of the main symptoms I've been having in general over the next few weeks. When I get to general updates, there's a lot more details in there that I'll get into. As for must-haves over the last few weeks, there's two big ones that I can think of. These t-shirts from Aerie, they're the distressed boyfriend t-shirts. I got these in a couple sizes up. I got them in a medium, and they are perfect for this stage of pregnancy. They fit baggy, they fully cover my bump. I can wear them with bike shorts and they're super comfortable. I'm not going to win any fashion shows looking like this probably, but they're very comfortable shirts, so I have a couple that I basically just rotate through. My other must-have is of course my hospital bag, which is now fully packed and sitting ready to go whenever it's time for baby to come. I am hoping to film a what's in my hospital bag video over the next couple weeks, couple days, I don't know. I'll try to get it done as soon as possible in case baby comes sooner than later, so stay tuned for that. Subscribe if you're interested in seeing that video as well. Okay, so I've been saying there's a lot of general updates in this video, which there are, so I will get into those now. I'll try to go kind of chronologically maybe. The first big thing that happened in this kind of time frame was that we did have to go to the emergency room for a few hours one night. I've mentioned before that I go for IVIG blood infusion treatments every week, and pregnancy in general makes you a higher risk for getting blood clots, and at these treatments they often mention that I should be watching extra carefully for symptoms of that. So there was one night that my leg, it had been aching all day, and then all of a sudden at night it was sharp pain in my leg, and I hadn't really done anything to cause that. So we did go in, they did an ultrasound, and fortunately there was no blood clot, but better to be safe than sorry. Then the following week, I was just over 34 weeks, and we actually made a trip into the labor and delivery triage. That day I had basically started feeling a lot of discomfort, and it sort of felt like intense gas pains that turned into sharp severe pain in my lower abdomen and a strong backache, followed by some regular intense contractions, and so it was starting to look like signs of preterm labor. So we went in. We were there most of the night. They monitored me with the little thingamajigs, I don't know what they're called, just to see what my contractions were doing. They checked my cervix. I was 1 centimeter dilated. They gave me some medication to basically relax my body and see if that slowed down the contractions, which it did. So they let me go home for the night, and I had an appointment the next day, and they checked my cervix again, and it still was 1 centimeter dilated. The contractions had basically stopped at that point, or they were back to just being every once in a while Braxton Hicks type of contractions. The next few days I was in pretty severe pain. It hurt to even move a muscle, so That was pretty uncomfortable, but it's gotten a lot better since then. I haven't had any more like regular contractions, so everything's looking pretty good there now. The other roller coaster has been our birth plan. It's just been all over the place, which I think is kind of the case with birth plans all the time. It's just like you can't predict what's going to happen or what the baby's going to do, so just have to kind of go with the flow. So I think the last I updated you, what was the plan?
Doesn't matter. There are only 4 rules you need to remember. Make the plan, execute the plan, expect the plan to go off the rails, throw away the plan.
I feel like we were booking a date to do a C-section or an induction maybe, but that we were going to try for a VBAC first. Honestly, I can't remember what it was at that point. But since then, we had one appointment where my doctor was feeling particularly skittish, in her words, about me doing a VBAC, especially doing an induction, just because with our blood condition, the baby is at a higher risk of a brain bleed. And so she was suggesting we just go for a C-section and that would be the safest in our scenario. So we kind of had to readjust our plan, get my head wrapped around another C-section again. That was fine. But since then we actually got some good news from a hematologist. They had done some blood tests to see if I was creating the antibodies that caused my daughter to be born with low platelets, and the good news is that I'm not actually making those same antibodies. So that could be that the IVIG treatments I'm getting are working, but either way they were saying that we don't need to take as aggressive an approach with my deliveries. So the most recent plan, we're still going to try to avoid an induction because those can just take longer, can be more traumatic experience for the baby, and so we're just going to avoid that altogether. But I have a C-section booked for when I'm almost 39 weeks. But the hope is that I will actually go into spontaneous labor before that, and in which case I'm approved to do a VBAC. Well, attempt a VBAC. We'll see. As of now, the baby is very low. We had an ultrasound yesterday and the tech was like, I don't know how I'm going to see his head. He did move, so that was nice. Things are looking kind of promising that I will go into labor earlier than that C-section date, but we'll just have to see. Just some updates on baby from my appointment and my ultrasound yesterday. He was measuring 5 pounds, 15 ounces, which is great. I figured that's probably about the size that Mila was because she was born like a week from now at 36 weeks and she was 6 pounds, 4 ounces. So I think they're probably about the same at this point. One thing that was really cool about this appointment, normally they will let you like pay to get a picture, and sometimes they'll leave a recording of the baby moving on the screen for me to record with my phone. But this time the tech just randomly was like, oh, I'll show you a 3D image of the baby, which I didn't even know that this hospital could do that. It was very cool, very weird though, because I felt like I was like meeting the baby, but not actually. So that was pretty cool. It was quite a clear picture. I was actually really surprised by that, but yeah, that was a cool experience. So I'll also share with you guys a bump update today. As you can maybe tell, baby is very, very low. He's definitely dropped. And I think you can see it in my like side profile of my bump, but I can definitely tell a difference in just like how I am able to move and not able to move. Definitely still getting bigger. I'm living in very comfy clothes because that is about all I can handle right now. So that does it for today's 35-week pregnancy update. I hope you enjoyed it and enjoyed getting caught up to date on what's going on with me and baby. I'm not sure what updates I'll be doing from here on out. I've been doing them every 5 weeks and baby's going to be here within the next 3 weeks, I think. So obviously I won't be able to do another update 5 weeks from now, but I may do them in a couple weeks if baby decides to hang in there a little longer. We'll just have to see. So hit that subscribe button if you don't want to miss any more pregnancy update videos, and of course we'll be announcing when the baby arrives. I hope you guys are having an awesome day and I will see you in the next video.